I have 3 different ratings for my left wrist, and I'm going to go through the CFR and tell you exactly how the VA is going to rate your wrist conditions. And at the end, we will look at common secondaries and pull up the DBQ so you can see what your C&P examiner says. And of course, I'll go over my 3 different ratings for my wrist. Now, to clear this up right now, because I don't want you thinking that you're going to get a solid 70% rating for your wrist. The 70% criteria requires amputation or the complete loss of use. Those veterans will be entitled to a special monthly compensation. Now, if you have both hands like I do and they both work, the most common criteria the VA uses to rate wrist conditions is actually pain with motion, meaning you can have full range of motion and still receive a 10% VA disability rating. Now, there is a rating criteria for range of motion, and that will be based on dorsiflexion and palmar flexion, or for those that like it Barney style, up and down. The range of motion criteria is still capped at 10%. So whether it's pain with motion or range of motion, it's kind of irrelevant. How the VA defines ankylosis, which is the loss of use for the wrist, is very similar to range of motion, except the degree of motion relates to a higher percentage. So yes, veterans can absolutely receive a higher rating for their wrists depending on the severity of that condition. The wrist under the loss of use also has a dominant and non-dominant criteria, and you can see the degree of dorsiflexion and palmar flexion in relation to that rating given. Now, looking at common secondaries, the most common secondary is going to be carpal tunnel and cubital nerve damage. These nerves run through your hand, through your wrist, and up to the arm. You can imagine having a wrist strain or surgery or anything crazy happening in the wrist that could probably pinch a nerve and cause some nerve damage. Scars are a solid secondary to wrist conditions too. So if you broke your wrist for whatever reason you had surgery, I would be on the lookout for a 10% rating for that wrist, nerve damage, and scarring. So 3 eligible VA disabilities from a 10% wrist. And that's how I got my 3 ratings for my wrist. I broke my wrist, I had surgery. So now I have a limited range of motion on my wrist. It's actually in pain quite a lot. I have a scar going from my palm all the way down to right below my wrist. And then I have carpal tunnel, making my fingers numb, which is a really weird feeling. It kind of sucks. But now let's go ahead and look at the DBQ for this risk, how the VA rates the risk. So risk conditions, disability benefits questionnaire. As always, my favorite part is this first section right here. So the provider will fill that out and then the evidence reviewed. And this is key, okay? If for some reason this box here is checked, all of a sudden this DBQ means absolutely diddly squat. So you want to make sure that your records are reviewed. That's going to be like your C file, your VA medical records, your service treatment records, your private medical records, whatever that looks like. Now, to start, you have your dominant hand. I'm right-handed. So all my ratings are for my non-dominant hand, which is my left. But depending on what you are, there it is. Now, there are tons of diagnoses in the wrist. Absolutely too many to count. And then if for some reason not on here, they can go ahead and annotate the diagnosis there. Medical history, so really kind of linking the bridge to service connection here. I always say the DBQ is the foundation of the Nexus, reviewing your medical records and then looking at medical history of that condition. Section 3 is range of motion, and that's what the majority of this DBQ is, right? I'll do it with my right hand. So dorsiflexion and palmar flexion, and they'll also go kind of side to side. So functional limitation of the wrist here. It keeps going, it keeps going, it keeps going. And of course, my battery died, but we're just going to kind of play this out. Looking at range of motion, so it keeps on going, tons of range of motion, right? So dorsal, palmar, ulnar, and radial. That's the left to right. Going down, more range of motion. As you can see, range of motion is extremely important. They're going to do this test multiple times, or at least that's what they should be doing. Muscle atrophy here. And so this is really whenever we kind of start getting into the severe-ish risk conditions. Then you have ankylosis, which is the loss of use. And you see it's extremely unfavorable, unfavorable, all these kind of check marks for each the right and the left hand. Then you have surgical procedures. So if you had surgery on your wrist, here we go, right? If you didn't, no surgery, no big deal. And this section here, section 7, kind of gets into secondaries. Let's just kind of say that, where you're looking at scars, you're looking at other conditions that would stem from the wrist, and then assistive devices. So is a brace needed for pain, whatever that looks like. Now, the majority of risk ratings are capped at 10%. And that's pretty much how the VA rates the risk. And my bad for my camera dying.